normal in the left side, and in the right side you have the brain which is damaged. The brain is damaged in a person who is suffering from Alzheimer's disease. That is called a neurodegeneration. So why this neurodegeneration happens in brain? Because it happens because of the accumulation or aggregation of a protein called as beta amyloid. We have several proteins in our body, and we know that brain is the very key organ in our body which we cannot easily repair, which we cannot easily cure the disease which happens which occurs in it, because the brain will have a protective layer around it called as blood-brain barrier. For any drug or any substance entering into the brain, this barrier will act as a protecting layer. It will not allow the drug or anything into the brain, because any small infection in the brain, it will lead to the body collapse. We cannot sustain if our brain is damaged. Brain surgery is also not that easy. So something which is happening in the brain, it is a natural process. The protein which is there in the body, in the brain, it is aggregating. What is meant by aggregation? It is just making as coagulation or the precipitate. Once the protein is precipitated, the acetylcholine, which is an enzyme required for normal functioning of the brain, it deactivates. When the brain normal function jaragali ante, we need to have good amount of acetylcholine in the brain. It sends signals to all parts of the body and make the body function normally. So once this brain is damaged, the neural cells are damaged, our brain will not function properly and the acetylcholine levels decreases. So when this is happening in the country, so many people are aged. Suppose you take China or any Japan, another country, whatever the country is. So the people, average people, age is 70 and above, they become old countries. In those old countries, how difficult it will be for other people to maintain those deceased people. In order to maintain the people who are don't have the they don't have the memory. How to manage such countries? So countries started inventing or discovering the drugs for this disease called Alzheimer's disease. So first generation drugs on these were the anti-acetylcholine drugs. These are all the published and patented drugs for Alzheimer's disease. So the main problem with these drugs, they underwent clinical trials. Before any drug to come into market, they have to undergo clinical trials. So they underwent clinical trials and they got approved. But the problem with them is they enter only a small amount into the brain. Their entry into the brain is very small amount. And one more thing is they are administered at a later stage of the disease. Suppose the person who is suffering from that disease, he is having some problem in recognizing his own relatives, in recognizing his own bed or something like that. So when the disease conditions are adverse, then only these drugs were given. So it is too late for the damage to recover. So it is always said that prevention is better than cure. We have to prevent the damage rather than curing it. So scientists later on they study these are other drugs and other methodologies which are invented for the treatment strategies of Alzheimer's disease are shown here. We know that the plant give extracts and those extracts are medicinally useful. Natural product chemistry that comes under. Next, nutraceutic acid. The nutrition in the food is used as a medicine, that is called nutraceutic acid. And other gene therapy and nanotechnology, these are the latest developmental techniques in medicine or chemistry or any research field. So these are all the techniques that are developed in later stages in the treatment of Alzheimer's disease. Next, the Alzheimer's disease process of curing that disease, scientists have thought that if we can recognize the accumulation or aggregation of the protein in the brain at the early stage, then cure will be to the maximum. So how to recognize the protein is aggregated in the brain? If the protein brain will start out in the aggregation, then the brain damage will start. If we can start recognizing that in that stage, then it will be very useful for the people so that more number of neurons are not damaged. So in this process, they have come to a new method of treatment or new method of drug development that is called theranostics. Theranostics and it is the upcoming technology in medicine or drug discovery, we can say. So theranostics is something that in a single molecule you are having both the diagnosing agent as well as the therapeutic agent. Okay, you have both to diagnose. అంటే diagnosis అంటే తెలుసు కదా మనకి ఎప్పుడైతే ఫీవర్ వస్తే we will go to the lab and we will diagnose whether it is a bacterial infection or a viral infection. So like that, in medicine we will have both in it, a diagnosis agent and a therapeutic agent. Both together will combine and give a proper treatment in the initial stages of the disease. So that is about theranostics. So these theranostics are helping a lot in recognizing or in treatment of the Alzheimer's disease in the early stages. Within the theranostics, this is a diagram which the pictorial representation of what can be used as theranostics. Small molecules, whatever the small molecules we synthesize in the lab as a part of research work or as a part of some project work, they can also be used as theranostics. Nanoparticles, we know that nanoparticles are nothing but they are of a very, very small size of nanometer, which can be easily administered as a drug and they have high efficiency when compared to large molecules. Next, engineered mammalian cells. This is the latest technology. Mammalian cells will be taken up, they will be protected or they will be conjugated with some targets, receptors, so that they will be again given to the deceased person, so that can be used as theranostics. So these are all the different strategies where theranostics can be used. So initial theranostics methods were based on MRI and PET methods. We all know MRI. Why we use MRI? To scan our brain, to scan any part of the body. Suppose we have some disease or something happening in the brain. So, or we have something happening in the backbone. What they will do first? They will go for X-ray or they will go for CT scan. Lastly, they go for MRI. MRI is a very what we can say penetrative method to find anything small damage even in the body. So MRI and PET techniques were used earlier for theranostic purpose, but they have some problem. MRI is they use some high powerful radiations so that the body gets damaged with those radiations. And again in the PET method, positron emission tomography, here they use the radio-labeled compounds. The radio-labeled compounds mean they emit radiation. So once they are administered into the body, they emit radiations and they may cause other damages to the body apart from this neurodegeneration. It may also lead to some cancers. So these two are not that encouraged nowadays. So the latest technology or the latest methods used for theranostics are the near infrared fluorescent probes. Okay, we all know that infrared light is not that damaging. We know light will have different fractions, and in that infrared is not that damaging. So whatever the probes means that which enter into the body and let us know what is happening in the body. Fluorescent is a compound which fluoresces, which give light. Right? So these are the near infrared fluorescent probes is the latest technology that is being undertaken now with a great effort by the scientists all over the country to diagnose the Alzheimer's disease at a very early stage. Okay, so what are the advantages of these fluorescent probes when compared to other theranostic agents? So they are very low cost. The analysis can be done very quickly. No extra personal training or anything is required because they can administer intravenously, and once they enter into the body, we can irradiate infrared light onto the body part whichever we want to study. Because of the absorption of the infrared light, these molecules change their configuration and they fluoresce. Fluorescent means the fluorescence of light. So these compounds, once they enter into the brain, and we subject that body or that mice under study to infrared light, that part of the brain where the protein is coagulated or aggregated, these molecules will show fluorescence. Okay, so that we can study or we can understand what part of the brain is damaged, how much it is damaged, like that we can know, and then In the same vehicle, we have the therapeutic agent also, so it will be cured. So this is the strategy behind the NIRF probes. So they are very much advantageous when compared to the other diagnostic agents. So what are the conditions that are required to develop a new NIRF probe? My current research is on NIRF probe development. I submitted a small research proposal for UGC as a part of new faculty scheme. So the faculty who are recruited recently, they can apply for that. So we have recently applied for a grant from UGC on this NIRF probe. Okay. So what are the conditions for a NIRF probe to be successful? It should have a moiety in it so that it absorbs the near infrared light. At the same time, it should fluoresce. First thing. Next thing is it should enter into the brain, so passing through the blood-brain barrier. So it should have enough of the alkyl moiety or hydrocarbon moiety in it, so that it resembles the lipid membrane around the cell and it can enter into the brain. So these two are the major criteria, and it should not be of very high molecular weight. So these are the conditions for a successful NIRF probe to be developed, a new one. Okay, so these are the conditions, and it should be rapidly cleared once the diagnosis is done. So these are the important criteria for a new probe if it want to be developed. So these are the list of diagnostic agents as NIRF probe are generally under MRI. So the developed and studied probes for diagnostics are these. These are published already. So these are the crown ethers. We know they have wide applications. Crown ether compounds. The probes which are having the crown ether, they are found to be suitable for entering into the brain through blood-brain barrier and resolve phenethylamine derived. Like this, so wide varieties of NIRF probes are discovered so far. And my strategy, our group, we are studying on the probe development of NIRF using the compounds that is called benzothioazole based amplifiers. This is one of my research project in my PhD work. The same with some changes we have proposed to be used as a NIRF group. Why we have chosen this particular group of set of molecules is because the benzothioazole moiety, which is here in the electrocyclic ring, it is found to have a greater penetrability into the brain barrier. First condition is it has to enter into the brain. If it has to show some action. So this benzothioazole moiety, it has greater penetrable power into the brain. Second thing, it has a alkyl chain. You can see that R1, R2 is equal to 16, 18 and all. So these long aliphatic chains will have a better penetrating power. That is one more condition for a NIRF probe. So this molecule is having both the conditions, and one more thing is the molecule should not be very large, and these molecules are not too large. And we also have a few more library of compounds apart from these, which have the benzothioazole linked with vitamin A and retinol. You know that, right? So vitamin A and other vitamin compounds, these molecules are able to form and self-assemble into liposomes. These are the nanoparticles which can enter into the brain. They can detect the aggregation or neuro damage in the brain, and they have also the therapeutic ability. So this is the purpose we are studying on these molecules, and the proposal has been said. We have already synthesized this molecule, and we are under the process of synthesis. The diagnostic ability or the probing methods will be done in the US. I have done my postdoc from US in the same collaboration. We are doing this work here. Here synthesis we are doing, and the remaining part is very costly. We don't have that much equipment here. So we are in collaboration with the US university for the successful implementation of the project. So these are the criteria. I just now explained why we have chosen only benzothioazole based lipids for our concept of diagnostics. So with this, I will conclude that my topic of interest, that is NIRF probe, is today's advancement in the field of Alzheimer's disease. And Alzheimer's disease, of course, is not 100% curable. There is no method till date that can cure completely, but the damage which is happening can be reduced to a greater extent by the use of this method. And I would acknowledge the support from my head office, that is curriculum. I work under the curriculum in Tribal Welfare Degree College as a faculty. Thank you for cooperating with me. Thank you.
I invite the next participant, Mr. Oral Balji. He is listening to haircuts. Okay?
Since all are having we will be
and I'm very glad to present my research work here, which is titled as Robert selective trans-2,3 dihydrobenzofuran derivatives, tandem synthesis, crystal structure, and their antioxidant, anti-cancer activity. The main objectives of this research is to design a synthetic procedure for the synthesis of 2,3 dihydrobenzofuran in a stereoselective fashion and to evaluate the anti-cancer and antioxidant activity. Dihydrobenzofurans are naturally occurring compounds which shows very wide biological activity in nature. Here, some are naturally occurring dihydrobenzofuran derivatives are present. In literature, many code procedures are present for the synthesis of dihydrobenzofurans, but they are proceeding in a harsh reaction condition. In to overcome these harsh reaction conditions, we proceed in a eco-friendly manner. So this is the work where we have taken present minds treated with chlorine in an aqueous medium for 10 minutes in temperature. The salt was prepared. In steam, we have added aldehyde, aromatic aldehyde, and this is the diol or diol, and chlorine in a 20 more percentage as a catalyst for the leaves the desired compound in a chlorine. In order to get best optimization of the reaction, we proceed we do synthesize the compound by using different reagents and solvents at different temperatures. And we use to compose the humidity and chlorine water medium at 80 degrees centigrade for 3 hours. It gives the best equation. Here, these are the compounds library which I have prepared in that. By moving to the mechanism of the reaction, this is a two-step mechanism where in first step, this is a nucleophile addition of pyridine to the potassium bromide forms a intermediate A which is converts into its aldehydes, that is intermediate E. In second step, When choline is reacted with the pyrrolidinone forms intermediate lipids and which undergo condensation with aldehyde forms intermediate C. Intermediate C is the reaction with intermediate E after addition through intramolecular cyclization gives the desired product. The product was characterized by proton and C13 mass spectrometry. This is the single structure, single crystal exchange spectrography shows that this is a autonomic in structure and transgaseous selectivity of also shown by single exchange crystallography structure. And we have moved to the antioxidant activity which is done by immediate radical scavenging method which is done at five different concentrations, that is 5, 10 and 15, 20 milligram per ml. So here we taken 3 different heteroaromatic aldehydes where indole the fourth series is indole decarboxylaldehyde and shows better activity for better activity for antioxidant, whereas formaldehyde which is in yellow color is less reactive than other two heteroaromatic aldehydes. Here all the total compounds which I have synthesized between 4D, 4H and 6G shows the best antioxidant activity. Next to the anti-cancer activity, we have done three different cell lines, that is human breast cancer cell line, that is MCF7, human leukemia cell line KF562 and human cervical cell line theta. At the GI50 values less than 10 μg per ml shows the best anti-cancer activity which is shown by 4D. So these results was shown under the inverted microscope. Adriamycin is taken as the reference for the anti-cancer activity. Here the conclusion we have synthesized based on above experimental results from hydrogen compounds, choline has the potential to become an anti-cancer drug and antioxidant activity. Acknowledgements here. Thanks for everyone for acknowledgement.
It is clear up to 4 p.m.
So no one is there. What are presentation completed? So we have line check mechanical lab, which is beside the building, and we will meet again at 2:30.
ఈ అమ్మాయిని పట్టుకుంది గ్రోత్ ఇన్హిబిషన్ అని దాన్ని ఇంకో రకంగా చెప్తాను.
GF23.
Is the drug which shows 50% inhibition of concentration of drug for the growth inhibition.
Growth inhibition.